Good morning, Trinidad and Tobago. The pleasure is mine to welcome you to the Ministry of Health's COVID-19 update for Saturday, 21st August 2021, where we provide you with accurate and up-to-date information on the national COVID-19 response. Your presenters today are the Honorable Terrence Deyalsingh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and Dr. Miriam Abdul Richards, Principal Medical Officer, Institutions. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be your moderator for this morning's presentation. We begin with the CMO, who will present the latest clinical update, followed by a presentation on the safety and efficacy of the Johnson & Johnson vaccine. CMO.
Hi, good morning. Thank you, Al. Good morning to the Honorable Minister, to Dr. Richards, members of the media, members of the viewing and listening public. So I'll begin, as Al said, with the COVID-19 update for the 20th of August 2021. The total number of tests done at both public and private facilities so far, 295,872. New positives over the last 24 hours stand at 257, taking our total since March 12, 2020 to 42,839. Our total recovered patients so far, 35,896, with a total active caseload now at 5,728. Those persons in home isolation, 5,050. We stand at 1,215 deaths, and condolences to the families of all those persons who would have been lost during the pandemic. Total at step-down facilities, 98, and in quarantine facilities, 130. The Honorable Minister will go into the details as it relates to vaccination. Next slide. So I'll just be presenting a short presentation on the Johnson & Johnson Janssen vaccine. Next slide. So again, it's a COVID-19 vaccine, Janssen AD26 CoV2.S. That's the name in terms of development. Manufacturer, Janssen Cilag International NV. The vaccine platform is a adenovirus platform, which is very similar to the AstraZeneca, which has been used in Trinidad and Tobago. EU status approved by the WHO on the 12th of March 2021. Next slide. So again, similarly to AstraZeneca, both adenoviruses as the platform. We have also Pfizer, which is an mRNA, and we have Sinopharm, which is inactivated virus. Next slide. So it is a single-dose vaccine. So it's the first single-dose vaccine that we have approved by WHO and for use in Trinidad and Tobago. It's a one dose, 0.5 mils, given in the intramuscular into the deltoid muscle, which is the outside of the shoulder muscle. Basically, it is a very good vaccine for mass vaccination programs, as the immunity builds from the shot 2 weeks later. So it is very good for rollout of mass vaccination plans. Next slide. Side effects. Common ones we see: pain at the injection site, fatigue, headaches. Very rare, very similar to AstraZeneca, thrombosis with thrombocytopenia, and Guillain-Barré syndrome, which is basically very rare, both of them in the region of about 9 cases per million. Next slide. Contraindications. A history of anaphylaxis to any component of the vaccine is a contraindication to vaccination. Co-administration, as with other vaccines, for example the flu, a minimum of 14 days interval between this vaccine and any other vaccine against other conditions. Next slide. So efficacy of the vaccine, 66.9% against any symptomatic diseases, meaning that if it is thought to prevent 66.9% of persons developing any symptoms at all, even mild ones. 76.7% against severe disease after 14 days, and we see that going up to 85.4% 28 days after the actual vaccination. In terms of hospitalization, 93.1% against hospitalization after 14 days, and it goes up even further to closer to 100% after 28 days. Next slide. So this is just some information about the Johnson & Johnson and the variants, its efficacies. So we have studies in terms of the South African case, which is beta. For moderate to severe critical disease, 64% effective, and severe critical disease, 81.7%. Against the P1 variant, which seems to be the dominant strain in Trinidad, 68.1 for severe disease, and severe critical disease 87.6%. Next slide. Yeah, so in terms of the Delta variant, what the Johnson & Johnson company has said in a release in July 2021 indicated by the media release that this vaccine showed good neutralizing antibody response, possibly surpassing the response against the beta which was shown in the previous slide. Last slide. So again, all of this to say thank you for the vaccination effort so far from the country, and as we continue to vaccinate Trinidad and Tobago. That's my clinical update for this morning.
Thank you, CMO. I now hand you over to Dr. Abdul Richards, who will provide us with the clinical stats for the parallel healthcare system. Dr. Richards, morning.
Morning. Thank you very much, Al, Honorable Minister, CMO, members of the media, members of the viewing and listening population of Trinidad and Tobago. Thank you very much for your continued attendance at our press conference. This morning, I would like to provide a summary of the status of the 16 facilities within the parallel healthcare system across Trinidad and Tobago. Our current capacity at this point in time is 1,022 beds between Trinidad and Tobago. So I have a short slide presentation that I would like to share with all of you. The rolling average, which is the average number of cases per day over the last 7 days, is 187 if we take the confirmed number of cases yesterday of 257. And this number of cases is used to predict the additional need for beds and resources over the next 3 to 5 days. Next slide. We also look at the admissions and discharges, and there has been a consistent trend as required with the admissions and discharges over the last week. We can see that the number of admissions, which is the orange line, continues to be more than the number of discharges, which is the green line, but the gap between the admissions and discharges is similar to that of last week. It means that the additional number of patients in the parallel healthcare system from last week to this week was a similar number. In the next slide, we look at the breakdown of admissions and discharges, and the blue line represents admissions, and we would notice that the number of admissions was very similar to the previous week. The green bar represents the number of discharges, and there have been less discharges. Admissions and discharges are based on the clinical severity or how sick the patients are, and it represents that we still have more sick patients within the parallel healthcare system than well patients. The next slide would actually show the actual number of net or additional admissions into the system, and we can see a very similar number of 124 this week as compared to 127. We also look at the actual number of patients within the parallel healthcare system as a trend, and in the 9 hospitals across the parallel healthcare system, there are 307 patients today. It is important to note that there are 3 children out of that 307 in hospital. In our step-down facilities, there are 107 patients, giving a total of 410 patients. And we continue to see a pattern of 3-to-1 hospital step-down, indicating that there are more ill and sick patients than recovering patients. The overall occupancy of the parallel system is 40% this morning, meaning that 4 out of 10 beds are currently filled. This has been a consistent trend since July 15th, with the exception of 2 days when the occupancy increased marginally to 42%. The next slide shows a breakdown between Trinidad and Tobago. And in Trinidad and Tobago, 41% of beds are occupied, 4 out of 10, while in Tobago, 35% of beds are occupied. The next slide would show the occupancy, which is a guide to how well the hospitals that manage the severe and critically ill patients in the parallel healthcare system are managing. And a similar trend continues to be noted, with 6 out of the 7 hospitals in Trinidad being under the critical threshold of 75%. There is only 1 hospital in Trinidad and Tobago that is at 76% this morning, which is the Augustus Long Hospital. Across our step-down facilities, 8 out of 9 are under the critical threshold of 7%. with only the area hospital Point Fortin at 81%. If we broke down by category of care, and this is based on how sick patients are, we would note that the percentage occupancy of ward patients is 37% this morning. ICU occupancy continues to be high at 80% this morning, which is roughly the average that we have been noting since July 15th or so, and high dependency unit, which is the intermediate level of care between ward and intensive care, is at 48%. It means that we continue to have very ill patients or very sick patients being hospitalized. The next slide would look at the accident and emergency clinics and sites in the traditional healthcare system. And by and large, we continue to see low numbers of persons being admitted to the accident and emergency requiring transfer at 8 a.m. every morning. We also look at the ambulance transfers, which is demonstrated in the following slide. And by and large, again, we've noticed that 30% of the National Ambulance Service is being used at this point for the transfer of patients. And the majority of patients are being transferred between facilities and not necessarily from home to facilities. And that 30%, I'd like to reiterate, would be the usage of the current system. Lastly, the turnaround ambulance time continues to be constant at around 120 minutes from the time a patient calls or relative calls to when the ambulance drops them off and returns to service. In closing, ladies and gentlemen, the parallel healthcare system continues to hold on or about 40% overall occupancy. We have noticed this consistent trend since July 15th. The Ministry of Health continues to do all in its part to save lives. However, you need to do your part. We appreciate and thank you for following the 3 Ws and the public health regulations. But as the CMO indicated, and the Honourable Minister will do shortly, please ensure that if you are eligible to be vaccinated, please vaccinate and have those around you to be vaccinated. Thank you very much, Al, and I pass back to you now.
Thank you very much, Dr. Richards. We close off this morning's presentations with Minister Deyalsingh, who will update us on the national COVID-19 rollout, vaccination rollout, including the significant gains achieved this week regarding the vaccination of minors with the Pfizer vaccines and yesterday's arrival of the Johnson & Johnson single-dose vaccine. Minister.
Thank you very much, Al. Good morning to the Chief Medical Officer, my partner in crime, my other partner in crime, Dr. Mariam Richards. Good morning to ladies and gentlemen of the media. Very good morning to all persons listening, viewing on the various platforms at both home and abroad. So my job this morning is a rather pleasant one, to continue to advise the population where we are with our vaccination plan. I think the talk for the past week has been where we are with our Pfizer vaccination plans for our cohort of citizens and non-citizens between the ages of 12 and 18. Before I ask for the slide, I just want to explain where we are. We are going to be reaching out this week to that 12 to 18 cohort to access the Pfizer vaccines, as we did with AstraZeneca and Sinopharm for the over 18s, to those groups of persons who are challenged in one way or another. So as we did, we had reached out to persons with autism, Down syndrome, the physically handicapped, the visually impaired, the deaf, and so on. We'll be doing a similar thing now that we have the Pfizer vaccines for 12 to 18. So we have already started to reach out to the organizations that represent this cohort. So organizations that represent and are concerned with persons between 12 and 18 with Down syndrome, autism, any other challenges, whether it's mental, physical, hearing, vision. We are here for you now. And please reach out to the Ministry of Health and your RHAs. We'll be making block appointments so that you don't have to line up with the other students. We are going to make it easy for you. We are going to give you express service to get vaccinated. Now I'd like this slide that I would like to put up. First of all, I want to congratulate the Ministry of Education for coming up with the slogan, Vaccinate to Educate, which builds on the Honorable Prime Minister's call, Vaccinate to Operate. So Vaccinate to Educate, we have all these sites set up for you, 4 in North, 5 in East, 3 in Central, and over 7 sites across South Trinidad, from Mayaro to La Brea to Point Fortin. Some of these sites in Deep South will be on a rotational basis as we try to use our resources in the most efficient manner. We hope to have a Debe site up and running by next week, hopefully by Wednesday. The Penal Power Gen site started up yesterday as planned. So as we rationalize our resources, especially in Deep South, we are going to, in the southwestern peninsula, there is going to be on a rotational basis. The Penal site is up, and we hope to have a Debe site up as early as next week. So we have about 19 sites under the rubric now of the Ministry of Education, and congratulations to my colleague, Minister Nyan Gatsby Dolly, for using that pun on words from vaccinate to operate now to vaccinate to educate. So let's get our kids out. Thank you for the slide. As I continue now, what are the figures that we have noticed with the Pfizer vaccine with our school-age population? The school-age population now is about 90,000. So far, we have vaccinated 10,759, which means we have reached about 12% of that school-age population, 12 to 19. Over the 3 days, we would have averaged about 3,586 per day, and 6 of those, and outside of those first dose, we have administered 6 second doses of Pfizer to children who return to these shores who received their Pfizer shots abroad. So that is where we are with the Pfizer vaccine rollout. I will now talk about the Johnson & Johnson rollout. As you know, we received 100,000. No, we don't need that slide as yet. We don't. I'm talking strictly about Johnson & Johnson now. We received yesterday over 100,000 Johnson & Johnson shots. I want to thank everyone who were involved in this purchase through the African Medicine Supplies platform, led by the Honorable Prime Minister, who was front and center in leading this charge. We could not have done this at the Ministry of Health without the full cooperation of sister ministries. The Ministry of Foreign and CARICOM Affairs, my colleague, Senator Amory Brown, the Attorney General, who had to vet all the legal documents, Minister of the Attorney General and the Legal Affairs Office, Minister Faris Al-Rawi, and also my colleague at the Ministry of Finance, Minister Colm Imbert, who had to actually pay for the vaccines. So it was a team effort under the watchful gaze and direction of the Honorable Prime Minister, which resulted in this. So, Johnson & Johnson vaccines, major benefit. 1 shot and you're done. As the CMO explained, 1 shot and you're done. The first tranche of these Johnson & Johnson vaccines will be sent to, and we are prioritizing in the first tranche, in the first instance, our remote coastal areas and villages. What am I talking about? There are many areas and pockets of communities in the coastal areas and even inland that want to be vaccinated but don't have the wherewithal to be transported twice to a mass vaccination site or even go to a health center. So, we'll be prioritizing areas like in the North Coast, Las Cuevas, Blanchisseuse, Matelot, Sans Souci, by going out to communities. The communities will be primed a couple days before via the MPs, their councillors, the RHAs, miking, messaging, so on, giving you the information. And then when these mobile units come in, you have an opportunity to liaise one-on-one with healthcare professionals to answer your questions about vaccines in general, but in specific terms to the Johnson & Johnson vaccine. And hopefully we encourage you in these areas to be vaccinated. So those are some of the areas across the North Coast. The East Coast, we want to reach people living in places like Kernahan, Guayaguayare, these communities that deserve their chance of saving their lives. In South, Moruga, Cedros, Los, etc. In Tobago, communities like Palatuvier, Charlotteville, Speyside, all of these communities, we want to touch you, inform you, give you the information, and then give you access to another world-class WHO vaccine. One shot and you're done. So if you have a fear of needles, your fear of needles is cut in half, right? I see Dr. Marion Richards laughing and agreeing with me here. So we are breaking down every single barrier to vaccinations. It's accessible, it's free, and now we are coming to you in this program of mobile units. And not only the coastal regions in Trinidad and Tobago, there are some inland communities. I could talk as an MP for St. Joseph. You have a community like Bangladesh. You have the train line in Marabella. You have Valencia, where you have these communities of persons who need their questions answered. And we are going to be going out to not only the coastal areas in the first instance, but also inland communities, where we want to answer your questions and encourage you to make the right decision. So that is where we are. That is the plan in the first tranche of the COVID-19 Johnson & Johnson vaccines. And as we roll it out, we will expand it, we will expand the reach to make sure that we add this 100,000 plus doses of one shot and you're done to our fully vaccinated figure. And that brings me now to the vaccine figures. And this is where now we need the charts. Right. So, first dose, 479,626, which represents 34% of the population. So we are going slow and steady. It could be better. I am never satisfied. But we could be doing better. But second dose, 364,599, which represents 26% of the population. If you go to the graph now, this is where we are graphically speaking. The green line represents our first shot number, 479,626. The aquamarine line, 364,599. What we hope to see now with Johnson & Johnson is that that aquamarine line picks up pace, because it's one shot and you are considered vaccinated 2 weeks after receiving that one shot. So what we are hoping with this push with the Johnson & Johnson vaccines into these areas, in the first instance, is that that aquamarine line will go up and go up, hopefully in a very real manner. So it means 26% of the population, after they receive their second shot or their first shot with Johnson & Johnson, and 2 weeks after to be considered fully vaccinated, you have over a 99% chance of not getting COVID as a serious disease, requiring hospitalization, requiring ICU care or HDU care, and you will not become a mortality statistic. That is the benefit of this. So thank you for the slides. Now we come to what the Honorable Prime Minister has authorized me to say this morning as far as relaxation of measures are concerned. Ladies and gentlemen, you may recall the Honorable Prime Minister at his press conference last week, Saturday, did indicate that all things being equal, and once our numbers are good, that personal services will be restarting on Monday, 23rd of August. I can confirm that the Honorable Prime Minister has authorized me to say the following. Yes, personal services will begin on Monday, 23rd August. And what do we mean? Spas, beauty parlors, facials, nail techs, hair salons, barbers, hairdressers, domestics, your housekeepers can now come in to your homes and provide you with those services. However, we appeal as far as humanly possible, because you can't do a facial with a mask on, but you could do a massage with a mask on. So we ask the providers of these services, as far as humanly possible, to keep your masks on, to not only protect yourself, especially if you are unvaccinated, but to protect you from your unvaccinated clients, because you have no way of knowing if that person coming for a facial has to take off their mask. But if you're coming to get your nails done or pedicure or manicure, please ask your clients to keep their mask on, and you, as the provider of that service, also keep your mask on. We are, and I suppose all three of us here, will be particularly concerned with domestic help coming into your homes, especially if that domestic help is unvaccinated. You are subjecting yourself as a home, especially if you have elderly, persons with diabetes, or children who cannot be vaccinated. Homeowners, you have to make some sort of judgment call, but domestic services are open from Monday 23rd. So let me repeat. Spas, beauty parlors, facials, people providing facials, nail techs, manicures, pedicures, barbers, hairdressers, people providing domestic services, gardening, etc. You are now under the rubric vaccinate to operate. But we know that not everybody will be vaccinated, but we encourage you, both as a supplier of these services and those who are going to receive these services, you have a mutual interest in getting vaccinated. I have been authorized by the Honorable Prime Minister to also say that all real estate services will be operationalized again from Monday, August 23rd. We deem this low risk, and also it's a serious area of economic activity. So all real estate services will be open for business once again from Monday, 23rd August. So all that is where we are with the Pfizer vaccines. Vaccinate to educate. I have given the country an insight as to how we plan to use the Johnson & Johnson one-shot and you're done vaccines. We have given you the current vaccination figures, and we have gone through the measures as authorized by the Honorable Prime Minister for me to communicate with the public where we are from Monday, 23rd August. Thank you for the opportunity, and we can now field questions.
Yes, as Minister said, as we move into the question and answer segment of this conference, We want to remind our media representatives to indicate their name and the media house that you represent before your 2 questions. Kindly indicate which presenter each of your questions will be posed to. And of course, as always, if time permits, we will field additional questions from each media representative. We will start with AZP News.
Hi, good morning, everyone.
Good morning.
To the Minister, with the availability of the AstraZeneca and the Pfizer vaccines, regarding a mix of first shot AstraZeneca and second shot Pfizer, would that be recommended, or somebody in Trinidad can choose this? As well as we have noticed that in the daily reports from the Ministry of Health that adults are also receiving the Pfizer vaccine. Can you give us some information, more information regarding this, given that it's supposed to be mainly for the persons 12 to 18? Thank you.
So I will take the second question. I can't see anything in the report that suggests that adults are receiving the Pfizer vaccines. The policy of the government is that the Pfizer vaccines at this point in time are reserved for people between 12 and 18. I stand corrected, but nowhere in the updates we send out indicates
200 Pfizers from before.
Oh, there were 200 Pfizers from before, if you recall, that came in for the Ministry of National Security. So that is what you are talking about. I do apologize for that. But this current batch of Pfizer vaccines is solely dedicated for the use of those 12 to 18, right? That 200 before was what came in a couple months ago for the Ministry of National Security from our counterpart agency in the United States. And that was a one-off. The CMO will now talk about the mixing of vaccines.
Yeah, so basically the policy of WHO still remains that, and the manufacturers of these vaccines, that if you have the first dose of a vaccine, for example, AstraZeneca, that you should follow on the second dose of the same vaccine, AstraZeneca as well. The policy of Trinidad follows that guideline for now. So Pfizer will be followed by Pfizer, AstraZeneca by AstraZeneca. Bearing in mind that what had happened is that in certain parts of the world, when the supply wasn't that good for a certain one of the two, there was mixing of the vaccines that occurred a few months ago. So AstraZeneca was followed by Pfizer, for example. Coming out of those events, research was done to determine the efficacy of that combination, and it has been found that an AstraZeneca followed by a Pfizer, for example, does have good effect as well. So WHO has recognized it as producing a proper immune response, and therefore for travel, we do have those vaccines being accepted. But for Trinidad at this point in time, we continue to recommend AstraZeneca followed by AstraZeneca and Pfizer followed by Pfizer.
Thank you very much, CMO. We now move to TV6. We are ready for your 2 questions. TV6. Okay, seems as though TV6 is not ready. So we'll go to Guardian Media Limited. GML.
Hi, good day. Renuka Singh from the Trinidad Guardian. Both my questions are for the Minister of Health. Minister, could you give us an indication as to what benchmarks we need to meet before TNT could consider reopening beaches and rivers? And secondly, we've heard reports from nurses at both the Cuba and Point Fortin facilities where they have seen that they are discontinuing their program where they receive food at the hospital, and they are now told that they have to go.
Could you repeat? You sounded very soft. Could you raise your volume,
sorry.
Please?
Do you want the second question? Did you get the first one?
Yes, second question, please.
Right. So nurses at both Cuba and Point Fortin, they have reported to us that they used to receive lunches and meals at the hospitals because they were not allowed to go out into the community and mingle to purchase lunch. But now they're saying that that program has ended. Is that something that you could address? Thank you.
Okay, so thank you for both questions. So the issue of lunches and nurses, while it's important, I will have to check with the CEOs of those 2 facilities to confirm that. So I will surely reach out to the CEOs, Davlin Thomas for Cuba and Dr. Brian Amore. On the benchmark for rivers, we have constantly and consistently said we don't look at any one data point to make decisions. We look at a whole series of data points. So the issue of reopening rivers and beaches has to be taken in the context of the massive steps we have taken to open manufacturing, to open retail with 80 to 100,000 employees moving plus their customers, to open construction, 45,000 persons moving, takeout, thousands moving. So we try to look at all the risks and see what the economic benefits are. And at this point in time, we are trying to focus on those sectors of society to open that are very productive, that engage thousands and thousands of persons in employment. We do recognize that at the beaches, you do have some employment, bacon shark, all of that, but it's a matter of risk and reward. So we continue to monitor all parameters before decisions are made to open. On Monday, massive opening. Risks with domestics coming into your homes who may be unvaccinated in an unvaccinated household. Risks with an unvaccinated hairdresser or barber cutting the hair without the mask of an unvaccinated patron. All those are risks that we have to consider. So thank you for your two questions, Renuka.
Thank you very much, Minister. We now go to TV6. Are you back?
Yes, I'm back. Sorry about that. I was having some technical difficulties. Good morning to the panel. Alicia Boucher from TV6 here.
The volume is very
I'm not sure whether the...
Alicia, please raise your volume, please. Or speak a little louder.
Now?
Yes, thank you very much.
Okay, so my first question is in terms of, I'm not sure whether it was asked, as I said, but do we have a ballpark figure, Minister, for the amount of persons living in these rural communities that would be targeted, and whether the 108,000 doses of Johnson & Johnson would be adequate to vaccinate those rural communities, or would we, would it just account for part? That's the first question. Second question is to the CMO. Dr. Parasram, do we know, since the rollout of Pfizer for children, do we know whether we've had any official reports of children suffering adverse effects from the vaccine? Thank you.
Thank you. So I'll take your first question, Alicia, and welcome. Haven't seen you here in a while. Okay. So CSO data will tell you, roughly, there are 100,000 a million persons over the age of 18 in Trinidad and Tobago. So far, we have vaccinated over 400 and possibly 80,000 of those. For rough figures, let's say 500,000. So there are 500,000 adults all over the country we still want to reach. We are going on an aggressive drive because we don't know exact numbers in Bangladesh. I mean, you could go into the EBC figures by polling division and get some sort of clue. So whilst we do all that, we are going to go into these communities regardless, right? EBC figures will give you some idea. But we are not going to wait to crunch those figures. We have prioritized these areas for 100,000. So that's our priority, to reach those persons in these communities, whether it's coastal in Trinidad and Tobago or inland in the communities I have described, and prioritize them. I would love, Alicia, if all 100,000 could be finished in a week. I would love it. Right? I would absolutely love it if these coastal areas and Bangladesh and the train line and Valencia, you have all these communities within Trinidad and Tobago where the information gap is great, where access is an issue, and that is why we are targeting them in a very special way to save their lives.
Hello. Yes, so answering your second question. So basically, I have been in contact with the Primary Care General Manager of the North Central Regional Health Authority this morning. I haven't received an official report, but there's an unconfirmed report of someone possibly having an allergic type reaction, which is expected for the Pfizer vaccine. A lot of the protocols that we build out in terms of the waiting time, 20 minutes, 30 minutes, and 15 and 10 minutes for your second dose, was built along the data that came out of the Pfizer vaccine in the US and other parts of the world as one of the first vaccines that was utilized for COVID-19. And what they found is generally between 0 and 15 minutes post-injection is where you have the highest risk of getting an allergic type reaction. So we built our centers, including our health centers, with the capability, including the manpower, excessive training to deal with allergic type reactions. They have all the medication that is required, and they all have ambulances on site. So we expect to have from time to time mild and a little, sometimes a little more severe allergic type reactions, but we have all systems in place. As I said, we had one suspected case from the North Central Regional Health Authority, not confirmed but not reported to me officially, but I have heard from the primary care general manager of that case.
Thank you very much, CMO. We now move to CL Communications. We're ready for your two questions.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. One of the things that came out of this week's launch of the vaccination program for the kids is the fact that parents have been talking about the emergency use license. I know you have addressed this ad nauseum before in the conference, but I'm bringing it back again because the point that, okay, if as a parent I give permission for my kid to have this vaccine, which is EUL approved, I'm allowing my child to have an experimental drug injected into them. That point is continuously being raised. And so I want the panel to address it again, even though you have addressed it before. And then my second issue is, I think I'm not sure if you looked at it before, but how have the Cuban nurses been dispersed? I know you said that they were going to be put in the ICUs, but I just want you to get more specific as to what locations. And then just, of course, address the issue of the bars still not reopening. Thank you.
Okay, so thank you. So, ladies and gentlemen of the media, we have to be very careful how we speak and ascribe adjectives. These vaccines are not experimental. let me make that point. And as responsible practitioners, I urge that we use the correct terminology. The vaccines are not experimental. Because you see, that is how the anti-vaxxers latch on to things. So let me say that. At an earlier press conference, Professor Carrington was explaining the difference between emergency use and full use. And I welcome the opportunity to repeat it. On a policy level, you look at three things to approve a vaccine: efficacy, safety, and the length of time immunity lasts for. And Professor Carrington was at pains to point out that emergency use license judges that in the throes of an emergency, which is a pandemic, once the vaccine is proven to be safe and effective, 2 out of the 3 parameters, it is licensed for emergency use. The third parameter, length of time of the immune response, we need some time. Now that you are seeing in the United States, the FDA has that type of data set now, the length of time for immunity. And they are poised to grant, I believe, on Monday, full authorization. So the 2 takeaway points. 1, these are not experimental vaccines. I think we really need to get that out of our vocabulary. They have gone through animal testing and 3 phases of testing in human beings before given emergency use authorization in a pandemic. Let me just see. Close to 5 billion shots have been administered throughout the country. Globally, we are administering 36.2 million shots a day. And when these terms about experimental are discussed in the public domain out of context, it really gives a picture of the vaccine which is not real. These vaccines have been tested in animal studies as per protocol, phase 1 in humans, phase 2 in humans, phase 3 in humans, and what we call post-market surveillance. Post-market surveillance is after the vaccine is unleashed in the global community, you continue to monitor its efficacy, its safety. And 5 billion shots in 183 countries have been administered. So I hope that puts the conversation in a proper context. I hope the adjective of experimental is one that we could possibly not use anymore, because that scares people. And I don't think you and I have that objective in mind. Thank you very much.
Thank you, Minister. Second question, we'll move on. Okay, so we move right on to... Thank you very much. We will now move to Newsday for your two questions.
Hi, good morning. Janelle D'Souza from Newsday. Really quickly, with the Janssen vaccine, the CMO mentioned South Africa, Delta, and Brazilian variant, but did we have any information on the UK variant? Also, has there been any update on the rollout of vaccination in pregnant women?
Okay. Just before the CMO comes, I want to answer the second question that Nadeline asked. She asked about rotation of nurses. As Minister of Health, I would not have that type of granular detail about the rotation of healthcare personnel in hospitals. My job is to make sure we are adequately resourced, to source nurses, to train nurses, and that has been done. But I wouldn't have that granular detail as to rotation of staff at the hospitals. Over to the CMO.
Yeah, so there's a dearth of data a little bit for the alpha variant, hence the reason I hadn't presented it as part of when I presented the other variants of concern and the effect of Johnson & Johnson. The data that we have with regards to variant requires two things: that the vaccine be used in that particular jurisdiction where the variant is present, and of course available widely. So in the instances where we have used Johnson & Johnson, you find it more in areas where we would have had the P1, the Brazilian variant, the South African variant, as well as the Delta variant. So the data is a little bit sparse in that regard.
Just to go back, Nadaline did ask about bars. Nadaline, the same full explanation I gave for beaches and rivers also applied to bars. Okay? So that same full explanation applies to any sector that we look at for reopening. Thank you very much.
Yeah. There was a question, I think, Al, on pregnancy.
Yes.
Rollout for pregnancy as well. Minister, you want me?
Yeah, okay. So the issue of vaccines and pregnancy is a policy issue which whoever is the Minister of Health is responsible for. So we held two rounds of technical discussions with PAHO Trinidad, PAHO Washington, CARFA, all 5 RHAs, private sector, OBGYNs, and a consultant from Jamaica, I believe. And as we said on Wednesday's press conference, we have broad, good consensus on the use of the Pfizer vaccines in pregnant women from the second trimester go forward. As Minister of Health, that has been signed off. What needs to be finished now is the communication plan and the implementation plan as to how we refer these pregnant women from second trimester onward to vaccination from both the public sector and the private sector. Dr. Adesh Sirju Singh will come on the press conference when the operational communication and referral plan is finished and alert the country as to the details of that plan. So look out for that soon in the next week or so. because we want to start this by the first week in September. It's a very important subgroup we are concerned about. Thank you very much.
Thank you very much, Minister. We have a follow-up question from the TV6. We're ready for your follow-up question now.
Hi, Alicia Boucher from TV6 here again. Minister, during the reopening of the retail sector last week, well, on Monday, DOMA's President Gregory Boone made a request to the ministry that we have in the data, in the reporting data, the number of persons vaccinated and unvaccinated that would have succumbed to the virus. I was wondering whether something, because he felt it would be important for the population to know and make an informed decision. Is there any way that can be included in the reporting?
Yeah, we began presenting that data a couple of weeks ago in the Prime Minister's conference. If you recall, we presented the number of cases vaccinated and unvaccinated in ICU, HDU, deaths. So those pieces of information were provided before, and we will continue to do so in the future.
Thank you very much. Do we have a follow-up question from the Newsday?
Yes, hi. We wanted to know, with COVID-19 cases among youths, can we get an update on the number? And CMO, has there been any monitoring?
Sorry, could you repeat the question? Just remember, it's just one question. Could you repeat the question, please?
The number of COVID-19 cases among youths.
The number of COVID-19 cases among youth.
So, Janelle, I'll take that question. There are currently 3 children that are hospitalized in the parallel healthcare system who are confirmed COVID-19 cases. These 3 children at present are stable. So, thank you.
And thank you, Dr. Richards. Ladies and gentlemen, we have come to the end of today's virtual media conference. Thank you very much for tuning in this morning. Please remember that the COVID-19 vaccine is an essential tool in the global fight against the COVID-19 virus. And vaccinations will allow Trinidad and Tobago to move from managing the virus to controlling the virus. The COVID-19 vaccines being distributed by the Ministry of Health are all WHO approved. They are safe, they are effective, and they are free. For the unvaccinated friends and relatives, co-workers, you now have a number of options available to you. Please don't delay. Do it for you, your friends, your family, and country. Let's all do our part. Let's vaccinate TNT.
There have been many conversations and concerns expressed about the COVID-19 vaccines and vaccination. So I'm going to share a few facts with you. Fact: vaccines protect against viruses that can cause disease and death. You may not remember, but during your first year of life, you were vaccinated against viral infections such as polio and measles. These vaccines protected you and are probably now protecting your children from death and complications associated with polio and measles infection. Fact: SARS-CoV-2 virus is here to stay. SARS-CoV-2 virus is the virus that causes COVID-19, and having entered the human population, it's going to be with us for a very long time. Vaccination protects us against it. Fact: viruses mutate and vaccines help to stop their spread. As we have seen, viruses such as SARS-CoV-2 are mutating all the time, and every so often they develop into what is called a variant, a fitter virus that spreads more easily and causes more infection. The more unvaccinated people we have, the increased possibility of these variants being formed because the virus can multiply in them unchecked. Vaccines stop the development of variants. Fact: the COVID-19 vaccines that we have are all effective and safe. Scientists have been producing vaccines for a very long time and have continued to try to make their production easier. We have benefited from this knowledge during this pandemic, and we now have a range of vaccines that are all very good at massively reducing severe disease, hospitalization, and death. I have been vaccinated with COVID-19 vaccine, which I trust will protect me and which will help me to protect those nearest and dearest to me. When Trinidad is vaccinated, we will stop the spread of COVID-19, we will protect those who have weakened immune systems or cannot get the vaccine at this time, and get back to normal. So Trinidad and Tobago, know the facts, share the facts, do your part, and vaccinate. TNT.
Vaccination is very important for the reopening of commerce and interaction in Tobago from a tourism perspective for a number of reasons.